With regard to their demographic and gynecological profile, the distribution of nursing staff by their age, it was found that nearly majority of the nurses, 47% of them were in the age group of 30 to 39. And marital status, nearly 66.2 were married. Nationality, I think predominantly they were Indians to the extent of 98.5%. By their religion, again, a majority, 64.4% were Christians. And with regard to their gynecological variable, that is distribution of the history of cervical cancer in the family, it was seen that only 13.6% of them had a history of cervical cancer. With regard to their level of knowledge on cervical cancer screening, it was found that majority of the nurses, nearly 70.5, had a good knowledge on cervical cancer screening in the score range of 80 to 100%. And with regard to attitude towards cervical cancer screening, it was almost equally divided between both favorable and unfavorable attitude, with nearly 54.5% with a favorable attitude. And summarizing their perceived barriers to cervical cancer screening, it was found that the psychological concerns, that is mainly anxiety related to the prognosis, was the most significant barrier to an extent of 87.1%, followed by the cost factor, which is 39.4%, and the time constraints was recognized to the extent of 37.1%. Pain and embarrassment were moderate concerns affecting around 30% of participants. And accessibility to these screening facilities concern existed, but opinions were found to be divided. With regard to their practice and uptake of HPV vaccination, this is an alarming result that was found in the study. It was found that only 4.5% of the participants had actually subjected themselves to cervical cancer screening. And a more alarming finding was that only 2.3% of them had taken the HPV vaccination. I think this is a real alarming finding from the study. There was no significant association that could be found between knowledge and attitude towards cervical cancer screening. However, a positive correlation was found to exist between the level of knowledge and attitude towards cervical cancer. So this were the major findings of my study. And however, there were a few limitations of the study that was carried out. One is the self-reporting bias and limited generalizability, because the study was conducted in a single hospital. And there was also lack of objective verification. And the recommendations is to conduct similar studies across multiple hospitals across Emirates, so that we can generalize and see what is the status, since the ministry is taking a lot of efforts in aligning their national efforts to align with the WHO 2030 cervical cancer prevention strategy, to see where we stand, and also to include the other healthcare professionals who are going to be actual, key factors in helping the public and as well as themselves to be motivated to take up the screening and the vaccination. And the implications is that I believe that the study findings can actually help institutions, when the study is carried out on the health professionals, to better equip their nursing staff to be able to be informed champions in this strategy of cervical cancer prevention. And the ethical considerations is, yes, an IRB was obtained, and permission was also obtained from TUH before conducting the study, and informed consent was obtained prior to data collection, and all other factors of confidentiality was maintained. I would like to acknowledge Gulf Medical University and Thumbay University Hospital and Professor Selva Titus Chaco, the Dean College of Nursing, for her constant encouragement for us to take up these faculty projects, and as well as the nurses from TUH and my co-investigators who helped complete the study. Thank you so much.
Thank you, Dr. Veena. Any questions? Yes.
Hi, Dr. Veena. Thank you for a good presentation. But I have a question. You got a correlation coefficient of 1, right? But your knowledge is high, practice is very low. how you reach a correlation
This was
coefficient?
not
What?
the correlation with practice. It was correlation between knowledge and attitude. The
Uh,
attitude was almost
but
equal.
Is it attitude is no, no,
No, it was not with the practice.
attitude.
Knowledge
Oh,
and attitude.
okay.
Knowledge was good and attitude was almost equal,
Okay.
both positive and
Thank
negative.
you.
Thank you, sir.
Any questions? Thank you, Dr. Veena.
Thank you so much.
We will stop the session here. Dr. Safa's talk will be carried forward for the afternoon. Thank you so much.
Good morning, everyone. I would like to acknowledge the presence of His Excellency Sayag, Mirza Al Sayag, BOT, Gulf Medical University. Welcome, sir. Thank you for joining us and motivating us today. I would like to also acknowledge the presence of Consul General, Republic of Indonesia, Kusma Prado. Welcome, sir. I would like to also welcome and acknowledge the presence of Saeed Ali Al Hajri, Consul General, State of Qatar. Welcome, sir. I would like to also acknowledge and welcome the presence of Yatin Patel, Deputy Consul General, Consulate General of India. We are just waiting for the arrival of our chief guest. Meanwhile, you can interact with our guest and have a cup of coffee. I think there is a small break, and I'm sure we'll continue with this. Today is the announcement of the Thumbay International Research Grant. Yeah, you can please,
Thank you all for your attention. We'll now take a short coffee break. Kindly ensure and return and make sure that you're seated before 11 a.m. as we prepare to welcome our esteemed chief guest, His Highness Sheikh Ammar bin Humaid Al Nuaimi, Crown Prince of Ajman and the Chairman of the Ajman Executive Council. Following his arrival, we will proceed with the highly anticipated announcement of the Thumbay International Research Grant winners. We appreciate your cooperation in maintaining the decorum and timelines of the programs. Thank you.
Like, very small, right? So if you want a pointer, I will give you a suggestion.
Yeah, you can connect the mouse and then we can.
Yeah, the mouse is already connected.
We can switch on.
Yeah, you just have to turn it on.
Yeah.
And
The
that's
laser.
the presentation option is.
Yeah, laser. It's possible, right?
Yeah,
I can see the presentation.
yeah, from here.
That's okay.
And now it will be the scan.
Dot is
Very small. I know.
We are glad to announce the arrival of His Excellency Dr. Sheikh Majid bin Saeed Al Noemi, Chairman, Rulers Court, Ajman. I request all of you to rise for the national anthem. Your Excellencies, respected members of the board, Vice Chancellors, Chancellor, faculty, and my dear friends. A very good morning to you all present here today. We are here to celebrate a momentous occasion, the Gulf Medical University GMU Research Day 2025, and to announce the winners of the Thumbay Research Grant. A heartfelt thank you to all of you who have accompanied us on this journey. Before we start this program, we seek the blessings of Almighty with a short prayer.
بسم الله الرحمن الرحيم الله لا إله إلا هو الحي القيوم لا تأخذه سنة ولا نوم له ما في السماوات وما في الأرض من ذا الذي يشفع عنده إلا بإذنه يعلم ما بين أيديهم وما خلفهم ولا يحيطون بشيء من علمه إلا بما شاء وسع كرسيه السماوات والأرض ولا يؤوده حفظهما وهو العلي العظيم.
As GMU gears up for the next phase of growth, Gulf Medical University, under the ownership and management of the Thumbay Group and the leadership of Dr. Thumbay Moideen, the founder, has its sights on expanding its global footprint. It is with great pride and anticipation we welcome you all to the official announcement ceremony of the Thumbay International Research Grant 2025. Hosted by the Gulf Medical University, Ajman, the visionary initiative driven by the commitment to advance global healthcare research represents a monument step towards fostering international collaboration, medical innovation with an impressive grant pool of AED 3 million and creating GMU a research hub. We thank His Highness Sheikh Amar bin Humaid Al Noemi, Crown Prince of Ajman and Chairman of the Ajman Executive Council, for his full support. We also thank His Excellency Dr. Sheikh Majid bin Saeed Al Noemi, Chairman of Rulers Court Ajman, for gracing this occasion on his behalf. I acknowledge the presence of Dr. Thumbay Moideen, the visionary founder, President, Thumbay Group UAE. We also have various eminent guests who are supporting us in this initiative. His Excellency Mirza Al Sayag, Board of Trustees member GMU. We have His Excellency Saeed Al Hajri, Consul General of Qatar. We have His Excellency Muhammad Assad, Consul General of Palestine. We have His Excellency Kusuma Prado, the Consul General of Republic of Indonesia, Dubai. I would like to also acknowledge the presence of Shri Yatin Patel, Deputy Consul General of India. Dr. Ursula Prelaj, Keynote Speaker, Head of AI on Lab at Institute of Milan, Italy. Welcome you all. As you know, the Gulf Medical University journey started in 1998 with the establishment of first private medical college in the UAE. And from there on, I think we didn't have to look back. We are here today celebrating 27 years and a fantastic Research Day 2025. I think we should see this inspiring journey through a short video. I request my AV team to play the video.
كل مرة أجي في هذه الدولة أو في أرجاء هذه الدولة في أي جزء منها أجد ما يسر الخاطر وأجد ما يستحق الفخر والافتخار في كافة المجالات.
في هذا اليوم تخريج طلبة من بناتنا وأولادنا ونتمنى لهم التوفيق ونشكر رئيس الجامعة والدكاترة والأساتذة اللي قايمين على الجامعة. نتمنى لهم التوفيق.
Very happy to have the college and the hospital here in Ajman, and this is good reputation to have it here in Ajman, and I hope all the best for the college and for the hospital. Muhiddin has our fullest respect, admiration for what he has done for this country and his services, and the most important commitment to the quality medical education that he's providing, and we see the fruits of his hard work, his commitment, and he has invested in the people, and that is the best investment for any country.
Gulf Medical University is a very premium university, one of its kind in the entire Middle East, and I happen to be the only Indian who has built a medical university outside India in the Gulf. We have a campus of about 1 million square feet of land and 1.2 million square feet of built-up area. Students from 100 countries, 8 colleges, 6 of them established, 2 of them happening now, many institutions, 3,500 full-time students and 1,000 part-time students. Thumbay Healthcare Division owns 7 hospitals, 5 medical centers, 5 laboratories, 46 pharmacies, all are academic setups. Students from various colleges are being trained in these setups. It's very unique, it's very trend-setting and very innovative of whatever we are doing in this country. Every hospital, every clinic, every pharmacy has an element of teaching, training students. And we are the only academic health system in the private sector in the entire Gulf. We are one of the only few universities which is going to be a research-based university in this beautiful country. With all this established, we have almost 15,000 floating population coming into the campus every day.
A truly inspiring story from Ajman to global. From the humble beginnings of GMU in education, Thumbay Group spread its wings into healthcare and became the #1 academic health setup in the country, with establishing the first private academic health system. And I would like to also highlight that the Thumbay Healthcare has conducted more than 90,000 deliveries, and today the babies born in GMU are studying at Gulf Medical University. I think that is a wonderful achievement and shows the commitment, perseverance of our founder. Without further ado, I would like to welcome Professor Manda Venkatramana, Acting Chancellor of Gulf Medical University, to propose his welcome address.
His Excellency Sheikh Dr. Majid bin Said Al Naimi, Chairman Rulers Court Ajman, Honorable President Thumbay Group, Dr. Thumbay Moideen, members of the Board of Trustees, Council Generals, Vice Chancellors, Deans, Medical Directors, research scientists, and colleagues attending online, faculty and students, Salam Alaikum. It's my proud pleasure to welcome you, Your Excellency, to be our chief guest for the day. Today is a landmark day for Gulf Medical University as we conduct our annual Research Day 2025 and also announce the recipients of the Thumbay International Research Grant, a visionary initiative of our founder president, Dr. Thumbay Moideen, with an initial fund of 3 million dirhams with the objective to advance medical knowledge and improve patient care and health outcomes in UAE and beyond. Gulf Medical University is the first academic health system integrating academia and research with healthcare, as we are well on our way to becoming a leading research-intensive university in the private sector. The enablers of research at Gulf Medical University include the Thumbay Research Institute for Precision Medicine, performing cutting-edge research in cancer and diabetes at the molecular level, the Thumbay Institute of Population Health, undertaking population-based research, and the Thumbay Institute of Artificial Intelligence in Healthcare, undertaking high-end research in artificial intelligence applicable to healthcare and digital health. Soon, we will be establishing a state-of-the-art artificial intelligence lab too. To give further impetus to research, we are offering 2 dual degree programs, PhD programs, one in precision medicine in collaboration with the top-ranked University Paris-Saclay, France, and other in health professions education in collaboration with Erasmus University, Netherlands, both the first of its kind in the country. I would like to commend the role of our faculty and students who have published in Scopus Index journals and enhanced the reputation and prestige of Gulf Medical University. I place on record the leadership of our Vice Chancellor Research, Professor Salim Shoaib, himself a cancer immunologist, among the top 2% scientists in the world and second in UAE. In enhancing the research ecosystem of Gulf Medical University. To top it all, the Thumbay International Research Grant Initiative has driven our research goal to the next strategic level. I would like to thank our founder president for initiating this grant, which has placed the Emirate of Ajman and this beautiful country, United Arab Emirates, on the global map in terms of research and innovation. I would like to thank Your Excellency for gracing this occasion and encourage us, and GMU is truly honored by your esteemed presence. Our Vice Chancellor Research will now be briefing you about the impact of the grant, the projects, the process of selection, and our future directions in research. Let us all await for the announcement of the awardees of the Thumbay International Research Grant 2025. Shukran jazeelan.
Thank you, Professor Manda Venkateramana. And now it's an honor to invite a leader whose guidance has steered Gulf Medical University research to remarkable heights. Please join me in welcoming Professor Salim Shoaib, Vice Chancellor Research, Gulf Medical University, to share his report on the research grant.
Assalamu alaikum. I would like first to thank His Highness Sheikh Hamar bin Humaid al-Nuaimi, Crown Prince of Ajman and Chairman of the Ajman Executive Council. I would like to thank him on the constant trust he has placed in us. We are proud to have him as a partner in our pursuit of excellence in medical education and research. His Excellency, Sheikh Dr. Majid bin Saeed al-Nuaimi, Chairman Rulers Court Ajman, Honorable Dr. Thumbay Muhaddin, Founder and President of Thumbay Group, dear guests and distinguished and honorable guests again. On behalf of the entire Gulf Medical University community, it's my honor to express our deepest gratitude for your gracious presence at our Research Day and the ceremony of Thumbay International Research Grant. Your participation, His Excellency, in this event is a shining example to your commitment to advancing medical research and education, and your dedication to the well-being of our community. The Thumbay International Research Grant is one of the important milestones of Medical University that Dr. Muhaddin Thumbay has initiated. It has differentiated GMU as the first We are confident that the partnership that will be initiated with the winners and the respective university will bring in international standards and new systems into GMU by introducing an innovative learning and research culture. Okay, let me say a few words on this award. The award covers 4 domains: precision medicine, drug discovery, and cancer immunology. The second domain is population health. The third domain is artificial intelligence and digital transformation in healthcare management. And the last one is innovation in health profession education. For the first call, we have received 192 projects, excellent projects, from more than 40 universities from 17 different countries. These universities are ranked among the top 50 universities in the world. This includes Harvard, Erasmus, Arizona, Imperial College, and Cleveland. We have shortlisted 42 projects, and our panel of international experts have selected 14 outstanding projects. And indeed, this was based on scientific merit, innovation, excellence, and potential impact on the advancement of medical knowledge and improving patient care. Dr. Mohamed, Mr. the President, be sure that the 3 million allocated to support scientific excellence and creativity will be put to good use and will enable more competitive scientific achievement. I finally would like to congratulate all the winners present here or are abroad. They are following us. We look forward to initiate or continuing our collaboration and to making meaningful contribution to the advancement of medical research and education in this country. Before concluding, I'm very pleased to announce the second call for the next year's application that will cover also additional domain, not only the 4 domains I have cited previously, but new domains like One Health, genetic, genomics, diabetes, bioinformatics, mathematics, and systemic biology. So thank you for being here today. We are very glad to have you during this ceremony. Thank you.
Thank you, Professor, for giving us insights into the research grant. I think it was an amazing activity conducted over a period of 1 year, and a lot of hard work has gone into it to shortlist and finalize the winners. So the big moment has come to announce it, and I request our founder president, along with the chief guest and chancellor and vice chancellor research to please be on stage. So, yeah. Before we move on, we would like to thank our chief guest today, His Excellency Dr. Sheikh Majid bin Said Al Nahyan, Chairman of Road and Sport, to be with us here. Thank you, sir. And we'd like to honor you. We move on to the Thumbay International Research Grant 2025 winners. I'm happy to call Dr. Tamara B. Kaplan from Harvard Medical School, Boston, in collaborating with Dr. Mohammed M. Al-Iraqi, faculty member, Gulf Medical University, on the topic titled Integrating Clinical Neurology RX Bricks into Preclinical Neuroscience Education. Please collect. Yes. We have several of them who could not travel today. They are from Boston and they are following us online. We congratulate you on winning this grant, and I hope the next Dr. Onicio Batista from University of Arizona, in collaborating with Dr. Vinitosh Mishra, faculty member at Gulf Medical University, on the project that is leveraging global fluidity from AI-driven digital transformation in healthcare. From Arizona University, collaborating with Dr. Vinitosh. The next I would like to congratulate and invite Dr. Reem T. Mullah from University of Water.
The project title Advancing Health Assessment for Older Adults, Middle East and North Africa, Utilization of
Assessment Systems. I would like to invite Dr. Hidayatullah Husseini from Regensburg University, Germany, collaborating with Dr. Jadhav Karimbai, faculty member, Gulf Medical University, on project titled Establishing Novel Therapeutic Strategies to Enhance Cancer Cell Reactivity through Targeting and Immune Therapies. Next, I would like to call upon Dr. Guido from Polisnio Ospedale Unity, Italy, in collaborating with Dr. Raifa Abu Ghazam, faculty member, Gulf Medical University, on the project titled Hypoxia Gene Signature as a promising biomarker to improve pancreatic cancer patient management. Next, I would like to call upon Dr. Bond D. Koenig from Erasmus University, Rotterdam, Netherlands, is collaborating with Dr. Mohammed Al-Iraqi, faculty member, Gulf Medical University, on the project titled Improving the Teaching Clinical Reasoning Using Chat. Next, I would like to call upon Professor Zaid Salem from Lebanese University, Lebanon, is collaborating with Professor Hisham Marai, faculty member at the Gulf Medical University, on project titled and a Vice Chancellor Academics on the project titled A Prospective Clinical Study on Minimal Invasive Implantology Techniques for Sites with Limited Bone Height and Narrow Regions. Next, I'd like to call upon Dr. Bilal Azkir from Beirut Arab University, Lebanon, in collaborating with Dr. Rania Zarur, faculty member, Gulf Medical University, on the project titled Comparative Study on the Effects of Water Pipe and Cigarette Smoking, Metabolics and Tumorogenic Effects. Next, I would like to call upon Dr. Hind Ahmed Ali Yassin from Alexandria University, Egypt, is collaborating with Dr. Marwa Mahmoud Abdul Aziz on the project titled A Precision Medicine Approach for Predicting Immunotherapy Response in HCC. Next, I would like to call upon Dr. Mani Satyam from RAK Medical and Health Sciences University, UAE, collaborating with Dr. Mahmoud Abdul Aziz, faculty member of Gulf Medical University, on the project titled Precision Torsion Horse Approach for Triple Negative Breast Cancer. Next, I would like to call upon Dr. Fahar Ali from Mohammed bin Rashid University of Medicine and Health Sciences, UAE, collaborating with Dr. Shubhankar Das, faculty member of Gulf Medical University, on project titled Disrupting the Spring 28 Conference. I would like to call upon Dr. Ibrahim Al-Sir CID 106-7700, a skin regeneration and wound healing. Next. I would like to call upon Dr. Mawai Hamad from University of Sharjah, collaborating with Dr. Raifa Abu Ghazal, faculty member, Gulf Medical University, on the project titled Elevating Hypoxia as Means of Improving. I would like to call upon Dr. Rose from Alain University, UAE, for collaborating with Dr. Mohammed Askandar Iqbal, faculty member, Gulf Medical University, on the project titled Targeting Metabolism for Personalized Improvement of Chemotherapeutic. A big round of applause to all the 14. Last but not least, we would like
Chairman of the Research Committee. Thank you, sir, for your hard work.
I would like to invite all of the people to please come on stage for all the winners today who received the memento. Kindly come on stage. You can stand in 2 lines. You can come first. All the we want to capture this moment. It's a very historic moment for Gulf Medical University. A big round of applause and congratulations. We request our honored guest also to, we can take a picture with us. Yes.
We thank our honored guests for coming all the way and supporting this event. I think this is a commitment.
I would like to once again thank all our guests. We will continue with our Research Day 2025 proceedings after this event. We once again thank you for joining us today. It was a great function to honor all the 14 trainers and wishing them luck. Kindly share your happiness on social media by tagging us on social media in the Gulf Medical University handle. We continue with the research day presentation series. I request the MC for the day to please take over the mic and continue with the research day presentation.
Whatever. Sisters sound മറ്റേ കണക്ട് ഇത് കണക്ട് ചെയ്യും ബ്ലൂ കണക്ട് ചെയ്യും അല്ല ഇത് സൗണ്ട് എടുക്കും യു കണക്ട് ചെയ്യും അത് കുഴപ്പമില്ല ഇറ്റ്സ് ഓക്കെ കണക്ട് ചെയ്യും ഇതിന് സൗണ്ട് ഇല്ലല്ലോ ബ്ലൂ
आप जाने बातें करने लगे और
ഇല്ല ആ Yes. You have a pointer there.
The point.
Yes. Yes, doctor. Yes, yes. The copy is in there. The stuff is there.
Yes. Have the point there because.
Yeah, you have a point.
Okay.
Yeah, there you are.
The presentation.
can send it back on the screen. Dr. Ali said. Yeah, no. Yeah, no problem.